person said that from now on they're only going to go to a black doctor after hearing that, and I personally don't think that's a bad idea.
Hello lovelies, and welcome back to my channel. If you're new here, my name is Belinda Strada. Thank you so much for all the love and support. Don't forget to please subscribe to this channel, turn on notifications so that anytime I upload a video, you will be the first person to be notified. And to my returning subscribers, thank you so much for all the love and support. To those people that share my videos, leave commentaries, you guys are the real MVP. Thank you so much for all the love and support. Alright lovelies, let's get into this video. So lovelies, I came across this video on my For You page on TikTok, and I thought to share with you guys where this, Jewish American doctor was actually giving the reasons why he would never treat patients well, and this actually got a lot of people talking, and I was just able to put up some stitch. Guys, I'm just gonna roll the clip as well as the stitches I was able to put together. Please leave me your thoughts in the comment section and let's get into it.
I don't want a patient who doesn't align with my values, because in general it's a relationship, and if you don't align, and it's not going to be a good outcome. No matter how good my surgery is, it's just not going to work.
Let me keep it all the way funky with you. When I go to the doctor, whether it's a dentist, optometrist, or I'm getting bladder surgery, I'm requesting or seeking out a black healthcare provider. And that's just what it is, what it has been, and what it's always going to be. I could spend hours unpacking how this surgeon just said, if you aren't a Zionist, the results of your surgery by my hands are TBD. I've heard people call black people dramatic for being afraid, weary, skeptical of doctors, hospitals, surgeons, the healthcare system as a whole. But I guarantee you there are thousands more like him.
Honestly, this gave me more flashbacks to the types of medical service I've received as a black woman over the course of my life, especially in times when I really did need assistance and I just received really subpar care. This is also factored into what has deterred me from continuing with certain sports and activities, because I'm thinking about whether or not I do something for fitness or for a hobby in the long term. If I'm injured doing that sport, what kind of medical care or the lack of medical care I will receive because I'm a black woman or because I don't particularly align with someone's particular values or subset of ideas. About 7 or 8 years ago, I was really into weightlifting. Like, I loved weightlifting. I loved what it did to my body. I loved the mental and physical benefits of it. I loved the confidence it helped me build. I took satisfaction in outlifting men who were twice my size and just skipping along happily. Like, I loved it at the time. But one particular incident, I did injure myself weightlifting. If you're familiar with those low-cost gyms that are very loud with men grunting like billy goats and slamming weights on the floor, you could very easily be distracted if you don't have all your necessary supplies to keep you from being distracted by all the chaos going around you. And so while I was squatting down with about 400 pounds of weight, I slipped, and I didn't have my sweat pad for my back, and I didn't have my headphones on to distract me from noise. Slipped, the weight fell, it slammed into my shoulders, and I was not sitting up straight for a while. So much so that when I went into work and I was sitting at my cubicle and sitting in a very weird position, my manager came over to me, he noticed, and he said, "Hey, are you okay? What is wrong with your back?" And I told him what happened at the gym, and he looked at me very oddly and said, "You should be in the emergency room. Why are you here at work?" And I, as a black woman, thinking about my experiences receiving medical care over the course of my life, and thought about how I felt like it would have been a waste of time, to be honest. So I planned to take the rest of the day off. I went into the emergency room with my mom, as a woman in her mid-20s at this point, hoping that her presence will help verify my story and give a little bit of assurance to me. And I got through perfectly fine with the initial patient intake. The first couple of people I saw were 2 black nurses and a black registrar. It was perfectly fine up until I got to my white female doctor. So I tell the story about the weight I was lifting and how I was squatting down and how I slipped and it slammed into my shoulders and I can't really sit up straight. And I think I either sprained something or broke something. And I think I need a CT and possibly something to treat the pain, or at least to numb the pain. Now, this doctor heavily implied that I was only there for painkillers. And I'm not talking about Advil, I'm talking about things like oxycodone, because why else would a black woman make up a story about weightlifting Going into the ER, she also then proceeded to ask me about my life and work. Like, what school did I go to? Where do I work? What do I do for a living? Because, can't trust those blacks that don't have white collar jobs and higher education. So once the answers I gave her were satisfactory, she ordered a CT, and even the black technician who was helping me with the heavy weighted garment you put on to protect your organs from the radiation even looked at me weird and was clearly seeing the pain and discomfort I was in. And when the results came back, she was just she wasn't even regretful. She just kind of wrote me a prescription, referred me to someone else to move forward, and that was pretty much it. But sometimes the care you receive as a black person in these spaces can be so dehumanizing that you much rather deal with the pain and the potential future consequences of not getting proper treatment because of the way you are treated in these spaces. And so now as an adult, I actively have to make sure that all of my doctors I go to are primarily black women, if I'm going to be honest. And if my doctor is non-black, it's normally someone who has been heavily vetted, and I have an understanding of where their values and ideals stand before, so that I can decide whether or not I'm going to stick with them long term. I have maybe two non-black doctors, and they've been heavily vetted, and they've been my doctors pretty much since I was a teenager.
Is to be decided, or they might F it up like my finger. So this person said that from now on, they're only going to go to a black doctor after hearing that. And I personally don't think that's a bad idea. And the reason is because, as you can see, this is what happened to my finger 2 months ago, and it's still not being straight. Now you can see how severe the dislocation is. When it happened, I called the ambulance and 2 people came. One of them was downplaying my injury so bad. They were like, it's not dislocated, it's not broken. I would recommend, if you just want to go home or get like a thing around it, they're like, it looks more strained. What happened is the guy that was driving the ambulance was actually coming from the back to take my health card, and he saw her saying that, and he saw my finger, and he was like, no, he's like, this is a severe dislocation, or it's a broken finger. And so imagine, he said that, and she was downplaying my injury so bad. He then told her to go to drive the truck, and he's the one who came and sat with me and gave me a whole bunch of painkillers. Now the thing is that eventually I realized that this person has different views than me in a certain topic. So, and like I won't go into detail about how I knew that, but anyways, so this person is absolutely right. Okay, unfortunately, especially if you're a visible minority, you never know who might assume things about you based on the color of your skin, what you wear, your background, whatever it is. And sometimes the risk is honestly too high.
So, good evening. I had to get on here because I kind of have a different perspective than the person who was stitching. So I do believe that this physician, however, was coming from the perspective of his political or maybe even religious values when it comes to treating patients, which I think is a little bit inappropriate because those things should never affect your ability to give great care. However, or to have great outcomes. But I will say this, as a surgeon, I always present to my patients all the options, surgical and non-surgical. If they ask my opinion, I will give them what I would consider to be the best advice for them. And then I have to allow them to make their own decisions. And sometimes I don't agree with the decisions that they make. And I always voice it. And I have to allow them to be able to sit in that information. However, if we've made a decision to go to the operating room, it is crucial to me that my patients are a believer in the philosophies according to Dr. Wilson Coleman. Like, I need you to be on board. I need you to be a teammate, a player. We are collaborating on this adventure, and I need you to believe in the philosophy that I have presented. I would rather a patient find another physician and go somewhere else. I would rather a patient get a second opinion before surgical intervention, because when we walk into that operating room, I want us to be on one accord. I think that relationship is important to not only the success for your surgery, but how you heal, how you interpret your healing, how you even interpret success of your procedure has a lot to do with the confidence you have in your surgeon, in the facility that you're being operated in your ability to have autonomy in your decision making. I think all of that plays into the success for a patient. I'm never going to bully a patient into doing something that I think needs to be done, even if I think that it's the best thing that they can do for themselves, because I just don't think that it works. I think it backfires, or, you can have poor outcomes that you didn't even expect because the person is coming in there with ill intentions while they're asleep on your table. I just, even when patients speak about death, I'm like, yeah, we will be canceling your surgery today, my love, because, I don't want that kind of karma or that kind of atmosphere in my room. I go in a room with joy. I'm playing music the whole time. I'm singing. I'm enjoying myself. And so I want the patient to come in there with that same ease and comfort. And if you don't have that, you need to find it, or we should postpone your surgery. So it's normal to have nerves and anxiety and fear. Yes. But there should always be underneath that the confidence in the surgeon who is performing your procedure. And if you don't have that, if you don't trust what's being said and you don't trust what is going to be done, then I think it's important for you to get a second opinion, or to find another physician that can give you that ease. The saddest part, though, is that there are some patients who have a lot of anxiety, and then sometimes I've had cases where patients have been very limited in their ability to understand the gravity of their procedure, the gravity of their diagnosis and the need for a procedure because of a religious issue. And particularly when we're dealing with hormones, sometimes I have patients who are not, they don't believe in birth control, so they don't want to use anything hormonal. And I'm like, well, don't think of it as birth control. Think of it as hormonal control, because you have a disease that if we do not treat can become cancer. And I've had some patients refuse to be treated, which is really hard for me. But then they still want you to see them every year. So you don't trust my medical opinion, but then you want me to still care for you when I'm watching catastrophic things happen in your body. So those can be really, really hard. And I try to express it to the patients when I'm in these situations that you're asking me to allow you to have autonomy, which I'm fine with. But you have to understand that your presence is uncomfortable for me because, every year that you're not allowing me to do something to you that I know is necessary, then I have the fear that I'm going to one day give you really, really bad news that I don't want to give to people. So, especially when it can be prevented. So that's my take on it. I think that, no matter what your religious belief is, if patients don't want to accept blood products, I'm fine with it. I always tell them to make sure before surgery that they ask their God, and I ask my God to make sure that they bleed very little, so we don't have to worry about that. And I usually don't have any excessive blood losses in my surgeries, thank God, because that would just be stressful too, to watch somebody lose blood, and I know blood could be helpful. But the same is true about any other, limitations that people have, or that they have, accepted or put on themselves because someone else made the decision. I think it's very hard to mix medicine and religion. I think that they shouldn't really be mixed for the most part, because a lot of people's misunderstanding about how things are used or what something is based upon just a misunderstanding of the medicine itself, or a misunderstanding of that disease entity. And so a lot of times people will not treat their endometriosis or not treat their uterine fibroids, especially when they're younger. And then as they age, we end up running into issues with infertility and sometimes cancer, because patients did not address things earlier because they feared what hormone could do to them. So it can be a very interesting relationship when you have to deal with people who don't quite agree with medical management. But I always tell them, and I tell my family this too, you don't ever want to ask a doctor to do something that they're not comfortable with. If there's something else that you would like done, then find a doctor who's comfortable doing that. If you want to be delivered at a certain hospital, if that doctor doesn't deliver there or doesn't do surgery there, then you don't really want them there, because where they're comfortable with is where they're going to be the most successful. So when you're looking to have certain things done, find the physician that meets your needs. And if you find that you're getting the same answer, then you will have to take a look at yourself and see what things you could be doing differently, so that you can get the outcome that you desire. All right, have a wonderful day.
I seriously love this. People really, really need to be very careful out there for such doctors. Like, if he can actually come out in public to, say stuff like this, he only has to talk about how he's not gonna be professional with maybe a client or a patient that wouldn't align with him, or that wouldn't, support him or agree to what he's saying. Like, this is a professional job that have to do with human, that have to do with human body. Like, this remind me of a video that I saw one time where a woman who happens to be a black woman, she was in a hospital, and a nurse, that's a pan-colored nurse, was there as well. She was in so much pain, and she was asking for a medical painkiller or something. I think she was just done with a surgery or something, but she was denied of these painkillers. And with that, one thing led to the other, and she was not there anymore. And coming from someone like this, like, these people do not even have a heart. So if someone do not agree to your own, to whatever you think that then you are gonna do this surgery like anyhow. Like, it's not gonna come out well, or because you felt that this person challenged you, or because this person was actually telling you what he or she is comfortable with. Like, what happened to the oath, what happened to your medical or professional oath? Like, I am so short of words. Like right now, I'm so short of words, because this thing is something that he can say so publicly and with his full chest. And I have thought of so many things. There are so many meanings to what he is trying to pass across there. Now, a lot of people should be aware of the reasons why there are too many complications in the medical field and all of that. So, in this kind of situation, like somebody like this, if you don't maybe agree to what he's saying, or maybe you're trying to tell this person that, okay, this is how my body system works, this is how I will like it when I'm being treated, or this is how my history is. So, because you are not agreeing to him or her as a bad person, which he is, then he will want to make you have some kind of complications, or because he wants to prove you so wrong, because you are not agreeing to what he's saying. Majority of these cases are necessary, maybe not because you actually had such complication, but because somebody wants to prove you so wrong for not agreeing to what he is saying. He's just gonna mess you up to prove that thing, that okay, you were supposed to listen to what I'm saying, you were supposed to align with me. It's your fault that you are having these challenges because you did not agree to what I'm saying. Like, seriously, in a medical field, something that has to do with like, when I saw this video, a lot of things were just coming through my mind. Like, This is the reason why they said there's a story, or there's a theory which I posted three days back, that in a place or in a community dominated with maybe black people, and actually a black doctor in that said community, that the high rate of, is high. Like, and meanwhile, if palm colored is treated or is treating eye, then you are just on your own. Like, why won't people be so cautious? Why won't people be looking? Why won't us, keep on putting our faith in the black doctors? Because of things like this. Because of things that a lot of them will use, what is happening on this earth, the angers and all of that, to come into the surgery room and do whatsoever they want to do. And if you feel that you want to maybe challenge them in the course of their procedure, not actually challenging them, but trying to make them understand what you feel that might be okay for you, because of maybe what you have, the experience you have had before. Maybe you're trying to express yourself. This person will just pick an offense and see it as if you are not agreeing to what he's saying. I know he's a medical doctor, and they have more chances to what they feel is okay for you and your own body. But when someone have an experience, I am saying this because I think I have had something like that in the course of a surgery. Like, this actually, really revived me back to some experiences. Let me talk about, of a friend whom I know. She is allergic to a particular kind of injection. That is, she undergoed a kind of a surgery. She's allergic to kind of a medication, which she was trying to explain to this doc. And he was like, okay, you're not going to teach me your job and all of that. And she was given the medication that took her life to the next level. I don't know why these people, I know they are all professionals and all of that, but at least your patient is your number one priority. Forget your rudeness. Forget the fact that you feel that you know it all. Your ego, your anger, or maybe whatever you have upstairs there, and just focus, because this has to do with someone's precious being. Like, seriously, people need to be very careful out there. You need to ask for doctors that you feel that you are comfortable with, you can discuss with, you can agree with. Just the way the last woman have stitched her video have explained, that some patients might be like that, but she like it when they are in the same page, when you agree in the same page. Even if you want to tell a patient of a certain maybe condition which you think might not be helpful for this person, you should be able to convince this patient before going to that procedure. As a good person, as someone who have a heart, you shouldn't do it in a state whereby, okay, since this person do not want to listen to me, this person do not want to abide to my own my own suggestions, and this person is trying to claim that he or she is so stubborn. Okay, let me just do it any way I want. If she got a complication, it's a complication. But this is actually not nice. If you know you're someone like this, if you know you don't really have that heart, maybe you don't have that mind, it's best you're not in the professional field. It's best you're not in that medical field, because this is, I saw a video which I was not even able to put it up here. A woman was teaching. She talked about how a patient she was treating happens to be someone who I think molested or was very cruel to her. But because of the oaths she took, she had to actually, take care of this patient very well. This is life. This is a profession. This is what you swore an oath for. If you know you can't deal with it, then it's best, it's really, really best you don't go into it, because you do not have any excuses or whatsoever to be cruel to someone that is defenseless or someone that is a verge of, but because you think that you have the authority, because you think that, okay, this person's, life is in my hands, so I will just have to do whatsoever I want to do. This is absolutely not acceptable, and people should just watch out there, because this thing has been going on, and especially in the Black community, especially in the Black, women that give birth, the higher, mortality and all of that. People have been complaining, and now they are coming out to actually, approve what people have been complaining and talking about, especially our Black community. So we have to, watch out. If it warrants requesting for a particular doctor, be it pan color, be it, Black and all of that, you should go ahead and do that. It's your life we're talking about. It's your life we're talking about, so you have the right to decide. It's in your hands. Do not let anybody, take you forcefully. Seriously, this has been going on for a while, and most of them are actually, coming out now to prove a lot of people right. Especially Black women have been talking about how they've been treated in terms of maternity, when they gave birth, how they treated differently from pan-colored people. And a lot of people usually shove it under the carpet, in the sense that, oh my God, Black women, they complain, they always want to be they always want to be surprised, they always want to be, the victim ones. But look at it. A professional whose wife is actually, I think, an actress, like, have to come out in public and claim this. He was like, no matter what you do, if you don't agree with me or align with me, it will come out successfully. Like seriously, what does this have to do? If you feel that a patient is in a distress, have you ever been in a condition whereby you don't even know what you're doing? It is left for you as a professional to calm this person. Even if this person is not agreeing with your own techniques, you should be able to give this person a reason why he or she should agree, without being, okay, let me just do it the way you want it. And okay, if it's, oh my God, seriously, when I saw this, I was so amazed. And he was like agreeing, yeah, people need to be careful out there. We need to watch out for each other. Make sure you sent for someone that you're very comfortable with. A doctor was teaching, Pam Colored doctor was made a video which I stitched. He was talking about how he feels so uncomfortable anytime people of my own type of goes to his office or comes for a medical appointment, but they come along with their family or friends or relation. And even if they don't come with them, they often come with their phone to call their relation on phone. And it makes him so uncomfortable. He's asking the reason why. This is the reason why. This is one of the reasons people of my own top of skin does that. They want to be safe because they don't trust you. They don't trust you. And it's so heartbroken that we are now in the society that we cannot even trust our medicals, our professionals, which happens to be the number one people we need to trust. because they handle us. Anyways, why not just leave me your own thoughts in the comment section of what you think of this video, and do not forget that we do not support any form of bullying, harassment. We're just here for information or informative purposes, educational, historical, and I will see you lovelies when I upload the next one. And if you have watched up to this extent, thank you so much for all the love and support. Don't forget to please leave me your own thoughts in the comment section of what you think of this video. And do not forget that this channel, we do not support any form of bullying, harassment, or whatsoever. We are just here solely for educational and informative purposes, guys. Alright, please just share this video, leave your thought in the comment section, subscribe to my channel if you are yet to do that, and I will see you lovelies when I upload my next one.